My name is Monica Smith and I'm an independent journalist from Australia, road tripping America looking for stories worth telling. Along the way, I met a councilman in Jacksonville who started a pilot program to help tackle the opioid crisis. It's called Project Save Lives, and that's exactly what it's done. It's saved lives. This video is not necessarily for the public. It's a practical information video from one professional to another on how to actually get this project running in your city so that you can also save lives.
Yes, we have an opioid epidemic, and yes, the pill opioid epidemic has been around since 1999, and yes, we should have done something about it, and we should do something about it. There's no question about that. But what's killing people today is fentanyl, and that's the opioid epidemic that we need to do something about today. No waiting.
Not only stop the dying, but I think we've saved a lot of money for the city and for the economy as a whole.
We saved ourselves here nearly $750,000 at our hospital system alone last year.
So what exactly is Project Save Lives?
The most important element first in terms of the foundation of the program itself was it was important for the addict's feet not to hit the ground.
We evolved from the traditional response to overdoses, which is to pick up, transport, stabilize in the emergency room, put them back on the street, many times withdrawing. This time we pick up, we stabilize, but we also treat the withdrawal, and we put them in touch with professionals who are former addicts who've been professionally trained.
We looked at all these different programs across the country and kind of took the best pieces and parts of it, and the biggest piece we knew was the peer recovery specialists, the former addicts. That part was what sold me. I said, you know what, they've never listened to me, they've never listened to the nurses, but from all the information that we had, they do listen to that peer recovery, the peer recovery specialists. So we said, we want to be part of that. I mean, we have nothing to lose. We're doing nothing now but watching people die.
In order to become a recovery peer specialist, you have to have at least 2 years of lived experience, either as someone in recovery from substance abuse or mental health disorder, or know a family member in recovery. So I personally am just over 9 years clean, so I am a person in long-term recovery myself.
When the identified patient comes in, the peer is alerted. The peer will merge right in with the doctors and nurses, find out what's going on, have that conversation, a narrow window will open up. The peer will open up about their own lived experience, and then they'll lead into the possibility of finding treatment or just receiving peer support services only.
What a phenomenal idea this whole program is, to put us addicts in the hospital with the addicts to try to help them, even if it's just, planting a seed. I get it when those people are in the hospital and they're in the emergency room, and I can tell the nurses and the doctors, they're not rude to them, but they're not exactly warm to them because they see these same people over and over again, and it takes somebody that's been through stuff like they have, like, hey man, let's give this guy a break, let's try to help him.
It's another set of eyes to help you manage that patient and deal with and talk to the families and create a relationship. I have so little time running around managing 20 patients in the ED. That person has time to spend with that patient and make a difference.
Dr. Pom was the one who stood up at a council meeting back in March 2017 and proposed this idea.
My mouth started moving and words came out and I was sort of watching the words come out saying, am I really saying this? But anyway, what I suggested was that, look, we really need to start a pilot project, and that project should be a treatment provider, an emergency department, and of course, city as a grassroots effort to devise a plan which will hopefully have an impact on stemming the tide of deaths, because we're having 2 deaths a day. I would want to set up a meeting with their fire and rescue, with a member of their city council who is passionate about this, with an identified emergency department that is at least willing to meet, and a treatment provider that works with the indigent and state funded. Start there.
And what do? I guess I probably just drive people and drive organizations and try and pull it all together. The first thing they have to do is be committed to changing. And then the next thing I do is get in touch with us, and we'll help you any way we can. I think we've got experience with the program, which, that's invaluable. It's taken us a couple of years to get to the point where we are today, and we can help them circumvent a lot of that because we can show them what mistakes were made, what things work, what things haven't worked, and so give them some real strong education and support on that.
doing so well, our detox is at capacity. Our medication-assisted treatment services are at capacity. We created a modified residential treatment program. Rather than 30 to 45 days or 60 days, it was 13 days. With the understanding that recovery peer specialists will be involved from day one, hold their hand all the way through it, and then they'd go right into outpatient, which would be a continuation of their treatment, not a separate optional piece of their treatment. Okay? So we're still using that model, by the way, and it's still working.
I think the program works beautifully. We need more rooms. There needs to be more detoxes available.
So if a patient agrees to come into treatment either from ED or a couple months later, weeks later, the peer will actually transport the patient directly into one of the providers to receive treatment, and then they're able to go into outpatient treatment once they've received residential treatment and even into aftercare. So again, the peer will stay connected for a full 90 days.
So when I heard about this and said, you know what, if there's something we can now offer, that was exciting. So I had to sell this to our ER doctors and say, you've never had a single tool in your chest to help these patients. Now you have something we can actually do. And they listened to me and said, yeah, sure, we'll see. We'll believe it when it happens. It didn't take long. Within weeks, the first time they started seeing these peers interact with the patients, they're like, man, this is unbelievable. They're getting involved in the program. They're going inpatient. They're going outpatient. They're not coming back in.
How is the actual practical implementation of it been for you in this department?
Exceedingly easy. It's great. I mean, wow, here's somebody that's salvageable but I can't do anything with, and I have somebody else to go in and do all the legwork and spend time with them.
After the initiation meeting at Park West Hospital, I asked this nurse what her first thoughts were about the program.
I'm all for it. Anything that you can do, anybody can do to get these people help. Right now they feel they have no option. And if somebody shows them an option, then at least it's hope.
They don't relate to the doctor, they don't relate to the nurse, but you put a peer in there and there's things that we can do, like keep them comfortable so they spend more time with that peer. That's what's making the difference. So to say that 67% of all of these patients that come in here with overdose are now getting attached to a peer specialist, either inpatient or outpatient help, is a huge number. And of that 67%, they're not coming back.
We didn't have the resources to get these people into treatment and recovery. We only had the ability to temporarily save their life.
I think we all realized something additional had to be done. We needed that next step. And I think that's what this project has provided us.
The process was to get involved, to get engaged, to follow the lead of our elected leaders, Councilman Gulliford, the mayor, Dr. Palm, St. Vincent's Healthcare, Dr. Gilberstadt, people that were showing up at these meetings saying, I'm here to help, tell me what we can do.
Just like any new project, I think across the board there was some skepticism. I've been pleasantly surprised. The data does show that this is working, and it is just the right thing to do.
Compassion fatigue is endemic to really any emergency services worker. Anybody that's going to the same type of patient, with the same outcome or lack thereof, it wears on you.
Overall, it's probably reduced our call volume of that nature, and again, probably the recidivism of that same person calling. Overall, that has improved effects on morale.
Jacksonville Fire and Rescue have also changed the dosage of Narcan given so that patients aren't in sudden withdrawal. This contributes to the success of the project.
We slowly give small 0.4 milligrams of Narcan and gradually bring them out. I think it's very important that now, especially with these programs, that we get them to these facilities so they can at least have the opportunity to be enrolled in these programs.
At the end of each interview, I asked them all the same question. If you were in a room full of people at the same professional level as yourself, from other states and cities around America, and you had less than 20 seconds to convince them to start this program, what would you say?
If you save one life, haven't you done something really great? I mean, really. That's the self-satisfaction of it. And we know that we've saved lives.
We have a relatively no-cost, successful model for you to implement, which will reverse the emotional toll it's having on your staff, and not only that, reduce the number of times someone's coming in and shorten the time they're actually in the ED, and you're contributing to saving a lot of lives, because we've only had 2 overdose-related deaths since we started the project, why wouldn't you?
I would say our mission as healthcare providers is to give every opportunity to save all people. And we now have everything at our disposal to make a difference in these people's lives and get them off of the drugs and keep them from repeat overdosing.
Tell me why not, and I'll tell you why you should. Is it a cost? I can tell you the exact cost of the program. I can tell you the millions of dollars that you're going to save by having a program like this. Is it because you have too much on your plate? I'll find you a grant where you can hire somebody. Tell me why not, and I'll tell you why you should.
Everyone involved in this project is ready and willing to help you launch this into your city and state. All you need to do is contact them and they'll support you through it. The link to our contact form is in the description below.